hired a little over a year ago to kind of continue the work that Dick Johnson's been doing here with the NV Tick program, which is mainly just a community outreach organization where we kind of work on raising public awareness about some of these issues. And we also collaborate a little bit with researchers to help their efforts as well. But today, we're going to be talking about Lone Star ticks and alpha-gal syndrome with Dr. Erin McGinty. So she's an allergist based out of Long Island, New York, has a lot of experience with patients that are dealing with alpha-gal. But I'll be opening up in the first 10-15 minutes to talk about the current status of Lone Star ticks and just kind of give you the background information that I see that feels important. Okay, so we'll start with adults and nymphs, and we're going to be focusing on Lone Star ticks here. So these are the main culprits for transmitting disease. You need to know that only adult female Lone Star ticks have that distinctive Lone Star or that white dot on them. Adult males and nymphs and larvae Lone Star ticks do not. So often the male Lone Star ticks can get misidentified because people just kind of look at that big white flag, and if it's not there, they don't think it's a Lone Star tick. But just be aware that only the adult female has the Lone Star. But here in Martha's Vineyard, they're active from March through September. This is the adults and nymphs. They're active March through September, with the peak months mainly being May through July. And when I say they're active in March, we really don't find them until about the third week in March. But I'll show some data where you can kind of see where they may not be out in numbers like they are in June yet, but they're still active towards the end of March when we get warm days. So they're a different little beast than deer ticks. They're aggressive and they're fast moving comparably or relatively for ticks, which means they just get on you fast and they bite quickly. It's a little bit different than deer ticks, which kind of might roam around looking for a good spot to attach for a while. Lone Stars, they can get on your body and usually will bite within a few minutes. Another thing to note about Lone Star ticks is that they will move horizontally in the environment, maybe upwards of 10 yards, 30 feet. They're more aggressive, so they can actively seek their hosts. They pick up on carbon dioxide that you're emitting, and maybe vibrations in the ground that while you're walking by or something. But they will actively kind of crawl towards you, whereas deer ticks, they do a behavior that's called questing. But they stand out on the edge of a blade of grass or a woody shrub, and they just wait for something to brush up against them. It's a much more passive way of finding a host. Lone Stars will quest too. They'll wait and wait for something to brush up against you, but they will actively crawl across the ground to seek their host. So it's not so much they're not going to chase you down the driveway while you're going to get your mail. But if you're sitting in one spot for 15, 30 minutes, picnicking, gardening, just laying on the ground, enjoying the sunshine, the Lone Stars can and will come out of leaf litter in the woods and can cross gravel or a paved road to bite you. So they're much more insidious than deer ticks. Change the slides. So here the main host for your Lone Stars is going to be white-tailed deer, but they're kind of generalists, but they'll fight just about anything medium-sized animal or larger. They're really not feeding on small mice and small mammals like deer ticks do. Interestingly, they're known as a turkey tick in the south. So the Lone Star is really it's a southern tick, Georgia and Tennessee and whatnot. But many research papers identified turkeys as an important host for especially the immature stages of Lone Stars, whether it's larvae or nymphs. They are a habitat generalist, as I would say. So if you think about leaf litter in forested areas, that usually means deer ticks. And grassy fields and green vegetation, especially grassy fields, that's where you find your dog ticks. Lone Stars, we can almost find it in all. We can find it in both. We areas, grassy fields, the sides of roads, pine straw, dune grasses, just about anywhere that's really not paved, mulched, or graveled over. And because they have that affinity to kind of move horizontally, you can end up finding them in some weird places. Like I've heard stories of people finding a lot of car bumpers just hanging out or on the side of your house. So here's data from the work that we do, whether it's through our residential yard surveys or drag sampling public trails. And this just shows the seasonal activity of the adults and nymphs. Adults being in red and then the nymphs being in blue. And it's just a graph showing how many we collect each survey throughout the year. So you can see the first bar in red, the first adults show up the last week of March. But it's really not until right now, first or second week in April, where it really starts to warm up, and you see that dramatic increase in Lone Star numbers. So 2 weeks ago, I wasn't finding any Lone Stars. Now they're out. Both adults and nymphs are out. I did a survey April 11th, and I found both in Oak Bluffs. So the nymphs, same thing. They come out kind of in the beginning of April, mid-April. Really not until mid-May and towards the end of May when we start hitting the summer months that we see. It's all like a nymph explosion. It's quite a dramatic increase in the number of ticks that become active because it's just the weather conditions are suitable for them. And then adult activity tends to wane towards the end of the summer. And usually by the end of July and in August, we stop finding adults, and then nymphs are still lingering around, and you can see on my graph I found nymphs as late as August 31st. I didn't do any surveys in September last year, but I'm sure you'd be finding Lone Star nymphs in the first week or two of September.
Hey, is that oscillation from week to week the weather or the number of surveys you did, or what?
So the taller the bar, the more ticks we found. So it goes from 0 to 50 on the count axis. So the tallest bar in between June 1st and June 15th, we found 45 ticks on one survey. And it just kind of gives you a general rule of when these ticks are active. It kind of shows when they first start to appear, that peak where you see the most activity, and then you can see the decline where you start to find less of them throughout the summer.
And they both can bite you.
Adults and nymphs will bite you and can transmit disease and alpha-gal. If we could just hold questions to the end, just jot them down, and we'll do a little Q&A session at the end. So now it's the larvae. They're a little bit different than the adults and nymphs. It's just this is the first biting life stage of the Lone Star. These don't come out until fall months, so you really don't see the larvae until August, mainly in September, and then in October they start to fade away as the nights get cooler. So Lone Star larvae are unique in that they're laid in large egg masses in dense clusters. So if you ever come across a patch of larvae, what's colloquially known as a tick bomb. You walk along and you all of a sudden look down and there's about 300 little ticks crawling up your leg. That's because you hit one of the egg masses that was laid. And it's easy to find hundreds of ticks in about a quarter-sized area on your pant. At first you think it's dirt, and then you look closer and the dirt starts to crawl up your leg. It's a little bit frightening. So in the tick world, and I learned something important today, in the tick world, the larvae generally do not transmit disease. You have to pick up the disease from their first blood meal. So they usually pick up the disease from the first time they feed, whether it's a mouse or a raccoon or what have you. But I learned today that alpha-gal, or getting bites from Lone Star larvae, may trigger and increase your sensitivity to alpha-gal. So in general, I'll still say that larvae are not going to transmit disease like ehrlichiosis or tularemia, but multiple Lone Star bites can trigger sensitivity to alpha-gal. Dr. McGinty will probably explain that a little further. I guess showing just to point out at the bottom, you can can see, so the pictures I have here are where we would drag a sample and pick up a tick bomb, and I just stick them to a lint roller. That's the best way to collect them. And you can see on the bottom right of the picture on the right, I collected about 4 nibs with all the rest of the larvae. So I hope it's hard to tell how small these things are. But the picture with the dime is on the back table. The physical ticks are on the back table. So if you want to get a sense for actually how small these ticks are, because people will contact us like, oh, we got a tick bite, and it was tiny. And most of the times, the nibs, which are in their own right tiny, when you see a larva, you really understand what a tiny tick is. And you really can't see them through the naked eye that well. Whereas nibs, you can see all 6 legs, and you can tell it's a tick. Just more pictures of what a tick bomb might look like if you come across it. The ticks are those minuscule pepper-looking dots inside the black circles. Don't pay attention to the grass seed. That's also this random hitchhiking seed. So if you find yourself in this situation, and remember the larvae are only in the fall months. They're only August, September, and October here. It's wise to sometimes have a lint roller. That's a great way to get them off your pants and off your leg if you happen to run across one. But lint roller or even like duct tape can help. Worst case scenario, you have them crawling on your skin, and what do I do? Just grab a towel or something and brush them off. They're honestly larvae are pretty delicate. I don't think they've developed that hard an exoskeleton, so you can almost rub the larvae in between your fingers to kill them and get rid of them. Just be prepared, because sometimes you will kind of end up getting bites on your forearms because there are just so many of them, and they're very small. So I'll go over a little bit about the current status of Lone Stars here. So like I said, I was a fairly new resident of Martha's Vineyard, been here for about a year. I've been told 10 years ago there weren't any, or the Lone Star ticks were just beginning to show up. So this is data from our residential yard surveys where we go out and visit a property, do a tick drag, and often we'll do like a private consultation on how you can reduce your risk and how you can make the situation better, which is available to anyone if there's a place to sign up on our website. But you can look at the difference between 2019 and 2022. I have it broken down by town and split out Chappie by itself. But this is looking at the percentage of yards where we find a Lone Star tick, whether it's 1 tick or 50 ticks. So you can see for every town from 19 to 2022, the proportion of yards where we're finding ticks has gone up. So we're finding Lone Star ticks in 5 out of 14 houses in Tisbury versus 0 out of 11 in 2019. So you almost see like a double increase in the number of yards we're finding Lone Star ticks. So this is just to kind of break that misconception that Lone Stars are only down Aquinnah or Chappaquiddick. You can still find them on properties in Vineyard Haven and Oak Bluffs as well. Here's a graph showing the breakdown of the species of ticks we collect in the yard surveys. So when we do the yard surveys, we show up and we'll just drag our flag, as it's called, to collect the ticks around the perimeter of the yard, really where the grass kind of meets the edge of your yard and the woods. So you can see the blue bars are Lone Star ticks, red bars are deer ticks, green bars are dog ticks. And this is just the average number of ticks we collect per survey in each of the towns. So you can see that in Aquinnah, Chappie, and Shoalmar, Lone Star tick is almost the most common we're finding in those yard surveys. Whereas West Tisbury is, deer tick is still kind of king in those areas. So I just want to drive home the fact that you can find Lone Stars in all 6 of our towns here, but they're for sure more predominant in the up island communities. Hopefully you can kind of see the dots on here, but this is just a map showing the location of the yard surveys we do. And this is a collection of data from 2011 to 2017. And each dot you see, regardless of color, is when a yard survey was done. The green and then the color and size of the dot just proportionally shows how many Lone Star ticks we found. So all of those green dots means we didn't find a single Lone Star tick. The yellow dots mean we only found one, which is not the worst thing in the world. But so you can see through 6 years of data, the Lone Stars were really concentrated in Chappaquiddick and down in Quinta, with one little outlier, a yellow dot in West Tisbury. Next. And we can fast forward to data from 2019, so this is just data for the single year. And you can see now many more colored dots throughout the island. You can see the Lone Star slowly encroaching north. And then if you look at Quinta and Chappie, you're starting to see bigger and darker colors, where we're just simply finding more ticks from when they were established. And this is data from the previous year. So the trend continues. We continue to see bigger, darker colors in the areas that the ticks were concentrated, but we're also starting to see darker colors in West Tisbury and the north end of the island. So again, I don't want to scare people, but it's good to be aware. I've had a number of people come up and talk to me. It's like, oh, I didn't think the Lone Star was here in Edgartown, or I don't think the Lone Star was here in Tisbury. And it's like they're definitely island-wide. They have concentrated abundances in parts of the island, but you can certainly find them anywhere. So those last few notes, what can we do to prevent this? And I could really kind of talk on and on, just do my own 40-minute presentation on tick prevention, but I'll try and keep it simple. And you can kind of take tick prevention, break it into two broad categories. But the first is personal protection, which I would say really reduces the number of ticks that you find on yourself and on your body. And then you can but you can also do external interventions, which aim to reduce the number of ticks in the environment that you find outside. And we really want people to focus on personal protection and making that a first priority. And personal protection, that means wearing long sleeves and long pants and tucking your clothes in to make sure the ticks don't crawl up under the cuffs and make it to your skin. But wearing protective clothing, using permethrin and other repellents, and then continuing with those regular tick checks. Because we can talk about external intervention, and we go through a lot of these options when I do those yard surveys, and each one of them has its place, and you end up getting hit with a lot of overwhelming options of what to do to reduce these ticks, and it really depends on the layout of your yard and the current kind of tick situation that you have. But of these options, usually the most effective are going to be removing the leaf litter and installing a deer fence. But we really want people to focus on personal protection. There's been a few research studies that come out in the past 3 years that are pretty interesting, where they looked at neighborhoods in New York and Massachusetts, and neighborhood-wide, where some houses received an intervention, like a spray or a host targeted treatment, like 4 posters or tick tubes, or a mouse targeted intervention, or something as simple as yard maintenance. But they compared houses that received some type of intervention versus houses or properties that did not. So what they found is that the interventions do reduce the number of ticks in the property, upwards of 50% or 80%. But importantly, the interventions, they did not result in a significant difference, or it did not reduce the amount of tick-borne disease that was present. So the idea was, if you have 100 ticks in your yard and you reduce it to 20 ticks, and you're still getting bit by the 20 ticks, that's how people are still getting disease. So that's why we really want people to focus on those personal protection options, because it really, I think that's your best bang for your buck for reducing the amount of tick bites. So last slide here, just my last plea for The most effective thing you can do for tick control and preventing ticks is to wear permethrin and use permethrin-treated clothing. So I've been here a little over a year. I work outdoors regularly doing tick surveys and whatnot, so no tick bites from me yet. But I'm very diligent about wearing my protective clothing and keeping up on the permethrin treatment. But when you want to do permethrin, there's essentially 3 options. You can have your personal clothing sent to a company like Insect Shield, and they will professionally treat your clothing, which lasts up to 7 washes. So you get it treated once, and it's good for the year. And that's really recommended for those who work outdoors regularly, or like to garden or go hiking regularly. You pick a set of outfits and have them treated. Excuse me. You pick a set of outfits, have them treated, and it takes about a 2-week turnaround to get that treatment, but then it's good for the year, and you really don't have to, remind yourself. And then the next option, which many of you might be familiar with, is like the at-home spray, the self-applied permethrin treatments, and these are just as effective as the professional treatment. It just doesn't last for 7 washings. It only lasts for about 6 washings or up to 6 weeks. So you just kind of have to remind yourself or set a timer on your phone, throughout the tick season, so you're covered through the whole year. And then the last option is you can purchase pre-treated clothing that's brand new. A lot of outdoor clothing brands will have at least an option or 2 that comes pre-treated. And then there's options available, whether it's clothing or pre-treated clothing or like the spray treatments. They can be found locally, like Brickman's or SBS in Vineyard Haven. I've also seen some options at Basics and O Plus. And then there's just last little bit of Limes.com. It's a tick gator, but it's just another option for tick preventative clothing, and just another tool in the toolbox. So maybe something to check out. I know Animal Health Care Associates is listed as an authorized dealer for Limes, but I'm not too sure what they actually have in stock. But Limes.com is something to check out. And that was all I had. If you just want to hold questions till the end, we'll have Dr. McGinty come up and give a thorough explanation and talk on alpha-gal.
Good evening. Hi. As Patrick mentioned, my name is Erin McGinty. I'm an allergist and immunologist in Southampton, New York. I live in East Hampton, New York. I spent most of my life in East Hampton. I grew up there. So I have a lot of experience both in my personal and my professional life with dealing with ticks. And what I'm going to talk to you about now is what this Lone Star tick, who apparently seems to be taking over your island like it did to our island, one of the conditions that it can cause. And my talk is called Midnight Anaphylaxis, Alpha-gal Meat Allergy from a Lone Star Tick Bite. Next slide. So I like to start my talk by going through a couple of typical cases. I don't know how many cases you have on the island so far. I'm sure there are some people in this room, I'm guessing, who have been diagnosed with this allergy. So I'm going to go through a couple of cases of how this allergy would typically present. So the first case is a 33-year-old white male. He reported multiple tick bites over the summer and then bites from the larvae in early September. Mid-September, he attended a beach barbecue. He ate sausages. He was drinking beer. He was surfing. He was running around playing volleyball. 3 hours after eating, he developed sudden onset of severe abdominal pain, congestion in his head, runny nose, and itchy eyes and throat. He didn't know what was going on, but he treated himself with 3 Benadryl, and gradually he got better. He came to my care in late September of 2018. His alpha-gal IgE, so that's allergy antibody, that's the test we use to measure if someone has this, was 24. It's supposed to be below 0.1. That would be considered negative. and his total allergy antibody was 289. That's something that will become relevant down the line. Oh, I'm supposed to tell you, if you're hearing lots of noise, they're setting up a Pinewood Derby back there. Okay, next slide. Second case is a 31-year-old Latina female. Similar history. She had gotten some tick bites over the summer, larval bites in the late summer, early fall. On August 28th of 2018, she ate beef and pork tacos for lunch. 9 p.m. Awoke with sudden onset of abdominal pain. She needed to have a bowel movement and suddenly broke out in a hive rash. Her throat swelled. She was having difficulty swallowing. She also self-treated with Benadryl, but then symptoms progressed. She ended up in the ER. Her alpha-gal antibody level was 4.2, so not as high as the other guys, still positive. Her total was 48. Case number 3, an 83-year-old gentleman, white male. He told me he didn't think he had any tick bites, but he did get chigger bites in August. And I'm going to talk a little bit about that in a while, but I'm sure you can imagine what he was talking about were these larval bites, okay? He had 3 reactions before he finally came and saw the allergist. In the beginning of September, he had a burger for lunch, and at 5 p.m., he broke out in hives around his waist. Took some Benadryl, he didn't know what it was, just ignored it. A few weeks later, he had a steak for dinner. 9 o'clock at night, so hours later, well, again, hives around his waist, and then he actually had a brief LOC, that's loss of consciousness. So he actually stood up and passed out. Again, didn't go to the hospital. He just got up and went about his night. The end of September, he had a burger for dinner. A couple hours later, again, woke up in the night with hives. Remember my midnight anaphylaxis. Got better over a couple of hours without treatment. Look at his number. His alpha-gal antibody was greater than 100. And his total allergy antibody was also very high. Okay, so anyway, what is alpha-gal exactly? So it is short for galactose alpha-1,3 galactose, okay? It's a blood group carbohydrate, which is another word for sugar, that's expressed in all non-primate mammals. So humans, apes, monkeys do not have alpha-gal, but all other mammals do. And the actual alpha-gal molecule itself is present on the tissues and cells of all lower mammals. And like I said, we don't have it. Next slide. So I'm going to go a little bit into the background and the history of alpha-gal allergy because it's actually quite fascinating and it gets a little nerdy here. So Martha Stewart ties into this story, and I know you guys probably have a lot of celebrities that come and frequent your island, and she's one of our local celebrities. In fact, when I was a high school and college student, I used to wait tables in the summers, and I waited on her many times. So I think it's kind of ironic that she's got an indirect relationship with alpha-gal. But you remember she went to jail for insider trading. That's because she found out that this drug made by Inclone, cetuximab, was not going to get FDA approval. And I'm going to tell you why. So she sold all her Inclone stock, she went to jail. What happened was it was going into phase 3 clinical trials, meaning it had gone through the first 2 phases, everything looked great. This is what we call a monoclonal antibody that treats certain types of cancers. It treats head and neck cancers and colorectal cancers. In certain states, Tennessee, North Carolina, they were seeing a ridiculously high incidence rate of severe allergic reactions to this drug. So in all the clinical trials up to that point, they saw an incidence rate of maybe less than 1% of severe allergic reactions. In a couple of states down south, they were seeing up to 22% of people who were having severe allergic reactions on the first infusion of this drug. So they had never had it before. They were having severe allergic reactions. There were actually even a few fatalities. That's why the drug didn't get FDA approval right away. Next slide. So this is Bert O'Neill from UNC who wrote one of those papers. He was just thinking it was so weird. He was calling his colleagues who were oncologists who were running clinical trials all over the country. And his colleague in Nashville, Tennessee was telling him the same thing. Yet if he talked to colleagues in other parts of the country, the Northeast or out West, they thought he was crazy. They weren't seeing anything like this. So we had to figure out why this was happening, because the fact that these patients were reacting, the very first dose, they'd never had exposure to this drug before. meant that they already had some sort of antibody that recognized something on this drug. Normally, to have an allergic reaction to a drug, you have to actually take the drug first. So when people have a penicillin allergy, they have their reaction on their second course. Their first course is when they become allergic. Second course is when they're reacting. But these patients already were reacting with their very first infusion. So what did they have? What's on the cetuximab that these people were allergic to, and why was it only happening in certain places? Next slide. So this is the fanciest, most complicated slide in my talk. It gets easier after this, I promise. But it's really, really interesting. They published this in the New England Journal of Medicine, which is like the biggie. This was in 2008. This was like the real big journal. And what they looked at were patients from Vanderbilt, that's column 1, other patients in the South. And someone who was a case was someone who had an allergic reaction to cetuximab. Okay? The third column were matched controls from the same area, from Tennessee, so age and gender matched controls who never got cetuximab and never had an allergic reaction. And then the last 2 columns were controls from 2 other cohorts, one in California and one in Boston. They were looking for groups where they weren't seeing a high incidence of cetuximab reactions, and they developed an assay to identify if someone had allergy antibody that recognized cetuximab. And what they're testing here are pre-treatment sera, meaning they're testing these patients' blood that they had it sitting in the lab in storage before they ever got a dose of cetuximab. So you can see in the cases are the red circles how many of the people who actually had reactions had actual IgE antibody to cetuximab. So this is measurable antibody to cetuximab. And these are people, 24 people, who didn't have measurable antibody, did not have a hypersensitivity response to cetuximab. Even more interesting was that the group that never got treated with cetuximab, who came out of Tennessee, also had measurable antibody to cetuximab, where you see very little to none in the other 2 cohorts. So obviously this is something regional that's going on, right? So what's on the cetuximab that people are having allergic reaction to is the next question. Next slide. Oh, well, I added another one. I don't know where it went. I will tell you, they were able to figure out that the part of the cetuximab that people were reacting to was alpha-gal. So cetuximab was made in a murine myeloma cell line, right? So when we make antibodies, we make them in a cell line, right? The therapeutic antibodies. That murine myeloma cell line had the enzyme in it that puts alpha-gal onto things. So they figured out that the part of the molecule that the people were reacting to was actually the alpha-gal part on the molecule. So now they know that the allergen is alpha-gal. But they don't know why people down south are reacting to alpha-gal, whereas people in other areas are not. So ticks, these are all out of order. That's okay. We'll get through it all one way or the other. Go ahead. So how did they figure out that it had anything to do with alpha-gal? Well, the first time this was actually reported goes way, way back. 1989, there was a woman, she wasn't even a doctor, she was just a woman who was working with her own allergist. They noticed that there were people who were developing allergic reactions to meat, and it was happening weeks or months after they got tick bites. They reported 10 cases. They actually wrote it up as like a case series and submitted it to both the Georgia Allergy Society and the CDC, and it kind of just went dead there. It was like a dead trail. We didn't hear anything about it for years. Next slide. The next time we heard about it was out of Australia. So they have this allergy in other countries as well. And a doctor by the name of Cheryl Van Noonan reported on 25 patients who lived in a tick-infested area of Sydney, and they developed red meat allergy after experiencing large local reactions to tick bites. So this started to make the suggestion to our researchers here in the States that maybe ticks could have something to do with this. So they set out to prove it themselves. So this is kind of a cool series of maps where you can kind of see the pattern. So the red states are where the cetuximab reactions were reported. Next. The stars are, this is back in 2011, okay? The stars are showing states where there are, the big stars are states with 25 or more cases of alpha-gal. Then the smaller stars are 5 to 24 cases, and dots are single cases. But you can see the biggest stars are kind of the same states where the cetuximab reactions were happening. Next slide. The red and orange are the states with the most cases of Rocky Mountain spotted fever, another tick-borne illness. So again, you're seeing the map kind of following the same pattern. And then next slide. This is like the geographical range as of 2012, the geographical range of the Lone Star tick. I said this when I gave my Grammy rounds this morning, and I like to say this really quickly here too. Just because like a third of the United States is covered does not mean that there's an alpha-gal epidemic in Manhattan, right? You find Lone Star tick in places where the habitat is hospitable for Lone Star ticks, right? So you need deer, you need small mammals, you need the right rural, ecosystem. So when you have the right place like you guys do, and we do, it's a big, big problem. If you live in an urban area, it's not. I don't really need to do a lot on this because I think Patrick covered this. Those are my chiggers. So if you hear people say they have chiggers, they don't. Chiggers are a thing, but I can guarantee you don't have chiggers here. We don't have chiggers on Long Island. And I'm friends with the head of the arthropod-borne disease lab for my county, and he will tell you right to your face he's never found a chigger on Long Island, and yet people argue with me about it all the time. When people are getting these bites, they're being bitten by Lone Star tick larvae, okay? And the one picture that I have that Patrick didn't have, he's got the ticks, I've got the ticks. But this is what the bites look like. Anyone in here ever have these bites? They're not fun. Even if you don't get alpha-gal syndrome, they are not fun. So you do your best to avoid those. Next slide, please. So the next thing they did was they did an interview of patients at UVA, just random patients who came through the door. They did a survey, and they took, do you have a history of tick bites? Do you have a history of frequent tick bites? And then they drew their blood, and they measured whether they had alpha-gal IgE, and they measured their total allergy antibody. So you can see the people who reported a history of bites, those are the red triangles, tend to run higher both alpha-gal antibody and total allergy antibody. They kind of trend together. Whereas the people with no history of a bite, which are the black triangles, they kind of had a range of total allergy antibody, but very few of them had measurable IgE for alpha-gal. And then the black circles are people who specifically said there's no way I had any bites. So they had total allergy antibody. Everybody has some, but they had really very little to no measurable alpha-gal, except for this one, who clearly doesn't know what a tick bite is. Obviously they had a tick bite. Okay, next slide. Then they took Lone Star ticks and they crushed them up, and they separated out all their proteins, and they took sera from 125 residents in Virginia, and they measured, do they have antibody against alpha-gal, and do they have antibody against proteins that are in the Lone Star tick. And you can clearly see the trend and the correlation. That's why we do the dotted line to make it really easy to see. But as people's titers to alpha-gal went up, people's titers to other proteins in the Lone Star tick went up. So all of these things are making a stronger and stronger case that this tick is what's causing this allergy. Next slide. This is 3 actual patients who did not have alpha-gal allergy and who tested negative for alpha-gal, but then got Lone Star tick bites, and they followed serial labs. So I'm going to talk loud because I'm going to walk over here. So the black is alpha-gal IgE level. So that's on the y-axis for each of the 3 patients, and the x-axis is time. The blue is just their total allergy antibody. And the red arrows are when they got tick bites. So I think you can see on all 3 patients, even if they were unmeasurable at the beginning, after they would get tick bites, both their alpha-gal IgE and their total IgE would go up. And then if they went for a while without tick bites, they'd actually start to go down. But then if they get a new tick bite, they'd go back up. 2 of the 3 patients in here who had not been allergic to meat at the start of this study actually had allergic reactions to meat. That's what the red stars are. And you can see that their allergic reactions happened when their alpha-gal antibody was at its highest. So it's something that changes over time. Next slide. Of course, now we know the Lone Star tick causes alpha-gal allergy. That raises some other questions. Are tick bites the only thing that can cause people to get alpha-gal allergy? We think yes, but I will say I do have patients occasionally who swear up, down, and sideways that they haven't had a tick bite, and I see their numbers go up. My colleague and friend from UNC, Scott Cummins, has a hypothesis that in someone who already has alpha-gal allergy, it's possible that if they got a honeybee sting or something, that could cause a transient increase. So that's something that we're looking at. But whether that can actually cause someone to get the allergy, we don't think that's possible. And then is it really only the Lone Star tick? We think it is. What is the mechanism by which tick bites induce production of alpha-gal IgE? So how does it happen? And why? Why is it going up? I would say it's going up because the Lone Star tick population is exploding. Next slide. Right, so we think in the United States that the Lone Star tick is probably the only cause. In fact, in that study where they crushed up the Lone Star ticks, they also crushed up some dog ticks, and the patients who were positive for alpha-gal did not have any antibodies to any of the proteins in the dog ticks, so that didn't really correlate. But it has been reported, as I mentioned, in other regions of the world, Australia, Europe, Scandinavia, Japan, South Africa, and different tick species have been implicated as the cause of the allergy in this region. So it's not like the Lone Star tick is the only tick that can cause alpha-gal syndrome, but it seems like it's the only tick in our country that causes it. We don't know why. Next slide. So the delay. So as an allergist, I can tell you that when we first started learning about this allergy, we didn't even believe it. We were like, no, food allergies are never delayed. Like, they always happen immediately. And patients would come in and say, I ate meat and I felt fine, and 4 hours later I was having anaphylactic shock. And it must not be the meat. It must be idiopathic anaphylaxis. It can't be the meat. Next slide. Normally, when someone's allergic to a food like peanut or something like that, they eat it, they immediately feel it. They feel it in their mouth. They spit it out. But in these patients, even though they have high titers of IgE to alpha-gal and to beef and pork and lamb next, they don't feel anything. They don't feel anything in their mouth. Their symptoms don't come for 3 to 8 hours later. Like, they feel completely fine 3 to 8 hours later, and it usually starts with itching. Not always. Itching, itchy hands, itchy feet. That's good. I already talked about this. Next slide. That's John Grisham. This is a fun one. Break up all the intensity here. So John Grisham is from the South, and this is an interview. This is from a very long time ago, 2011, and it was just at Sundays with John Grisham. And do you see this part down here? Any favorite dishes? I have this weird food allergy that started about 5 years ago, so I can't eat beef or pork, which is probably pretty healthy. We eat a lot of fish and fowl. I'd kill for a cheeseburger, though, or a big steak. So any of you in this room who have alpha-gal syndrome, you are in good company because John Grisham has it as well. Down at UVA, they wanted to prove that what these patients were saying was actually true. So they actually did some meat challenges. They actually fed these patients who had positive alpha-gal. So this lady, her alpha-gal IgE was 30. They fed her sausage patties from McDonald's. That's the challenge food. I know, they can't give you something healthy because the fattier the meat, the worse the reaction. They wanted to really prove it. So you can see her on the left, she's all pale and normal looking. And here, I hope you can appreciate this, right? Look at her hands, look at her, this part of her arms, totally red and blotchy, and I'm sure she was extremely itchy. Next slide. I'm sorry, that other one was 3 hours and 45 minutes after. Here's one, diffuse urticaria, that's just fancy word for hives. 4 hours and 15 minutes after the meat challenge. Fine until that point. Here, this guy, his alpha-gal was 29. He got these hives on his side, again, 4 hours and 25 minutes after eating the sausages. He's a big guy, he probably ate 3 sausages. So why is this delayed when other food allergies are not? Our theory is that it has to do with the fat. That's why we use sausages for the challenges. So fat is absorbed differently from protein or carbohydrates. We start digesting those immediately, even in our saliva. But fat is relatively protected from digestion for hours until it reaches the small intestine. So it's a very slow process. So that kind of makes sense. And what supports that hypothesis is the fact that we very, very clearly see that the fattier the meat, the more likely it is to cause a reaction in patients with alpha-gal syndrome. Next slide. It's unpredictable. that's also different than a lot of other food allergies. Okay, so a kid has a peanut allergy. It's not like one day they can eat a little peanut and one day they can't. This allergy changes for a number of reasons. It changes because the more Lone Star tick bites, the higher your numbers go. It changes because the fatty amount of meat you eat or the portion size you eat is a variable that plays a role. But there's definitely other cofactors that make it even more unpredictable. So someone might pass a meat challenge in the doctor's office and then go to a restaurant and eat a hamburger and have a couple beers with it and have a reaction, because alcohol can be a cofactor for allergic reactions. Medications like anti-inflammatories, exercise, which increases the circulation of things through your system, stress, illness, like menstrual cycle in women, all of these things can increase someone's risk of having an alpha-gal reaction. So even when a patient says, oh, I can sometimes eat meat, which they tell me a lot, especially the ones who don't want to believe that they have this allergy, there's a lot of variables that play a role in this. So I call it midnight anaphylaxis because most of the time it's happening after dinner, because that's usually when we eat our biggest meat meal. So it often wakes people up in the middle of the night. The most common things we see are hives and flushing, and people get very itchy. Abdominal symptoms are very, very prevalent in alpha-gal allergy, more than in other food allergy reactions. So people will get crampy, they'll get nausea, vomiting, diarrhea, and it comes on really suddenly. Syncope is a word for fainting. So like my elderly man in the beginning, they wake up, they're itchy, they're crampy, they feel like they have to run to the bathroom, and they stand up suddenly and they collapse, or almost collapse. And then the other allergic reaction symptoms we see a little less commonly: shortness of breath, tightness in the throat, swelling of the mouth. And usually when you're thinking someone might have this allergy, you ask about tick bites, and they usually say yes. Next slide. I'm going to talk a little bit about byproducts. And this is going to be like my little public service announcement that if you have alpha-gal syndrome, talk to a doctor who knows about it. Don't go on any sort of alpha-gal chat group, because they will scare the life out of you, because there's a lot of misinformation in those chat groups, okay? And I see you all nodding, so I hope that doesn't mean that you're all on it. Or if you are, I hope you don't believe everything you read, okay? So there are many things that are in food and processed food and medications that are derived from mammals. But that doesn't mean that every single one of those things has actual measurable alpha-gal on them. So this is a list of hypotheticals or things that people may have reported or read that could be a problem, but there really are only a few byproducts that clinically I see as a problem, and they're the ones I'm going to talk about. And that's gelatin and milk, okay? And even these are a small minority, are a problem in only a very small minority of patients with alpha-gal syndrome. So I absolutely do not tell every one of my patients with alpha-gal syndrome that they need to avoid dairy, nor does Scott Cummins, who knows more about this allergy than I do. Less than 10% of alpha-gal patients are clinically reactive to gelatin or dairy. So it's important to know that it could be a problem, but it's also not at the minute you have a positive alpha-gal test that you have to take all of these foods out of your diet. Reactions to these byproducts are generally dose dependent. So somebody who is dairy reactive might react if they eat like a pint of Ben & Jerry's, but if they have a slice of cheese on their turkey sandwich, it's not going to be a problem. I mentioned carrageenan. Like, I actually only learned about this in the last year. It's a seaweed. It's a thickener. It's from seaweed. It's not mammalian at all, but it has a small amount of alpha-gal in it. I've never seen someone react to it, and I've been taking care of this allergy for 11 years. Next slide. There's a couple of vaccines that contain gelatin, but only a couple that have enough that cause problems. And even these are rare. These are like case report rare. MMR, which is a kid vaccine. Most adults don't get the MMR. Zostavax, which is the old shingles vaccine. Most adults don't get that anymore because we have a good new one now called Shingrix that does not contain gelatin or alpha-gal. Influenza vaccine, there's a couple of influenza vaccines that have a little bit of gelatin in them. I've not clinically seen it to be a problem. There's one gelatin flu vaccine that's made in a canine kidney cell line called Flucelvax. I still think it's very unlikely to be a problem because I think there are so many people walking around where I live who have positive alpha-gal and don't even know it, and they all get this vaccine and they're fine. But in a patient who I know has alpha-gal syndrome, I'll just say, just don't get flu cell vax. There's like 10 other types of flu vaccine you can get. Liquid gels, gel caps, yes. Theoretical concern, yes, I've seen it. I could probably count on one hand, and I got 850 patients with alpha-gal. So it can happen. If you have another option, if you can take a medication that's not in a gel cap, better. But it's still what people will tell me. They find out they have alpha-gal, and they're like, oh, does that mean I have to stop taking my vitamin D liquid gel? And I'm like, well, I don't know. I just found out you have it. It doesn't mean like, you probably had it yesterday too. Did you take it yesterday? Were you okay? Like, just because you have it doesn't mean by default you have to take it out. If you're taking a liquid gel and you're tolerating it, then you're tolerating it. Now, if you got new Lone Star tick bites and your numbers went up, could be an issue. Next slide. Dairy. I talked to you about dairy. I talked about the ice cream. The only bullet I want to talk about here is in my patient population, the very few who do react to dairy, and there are patients who react to dairy. It's just not many. The ones who do have incredibly high alpha-gal antibody to total allergy antibody ratio. So I always check both. I check what their alpha-gal number is. I check their total. The higher that ratio is, the more allergic you are. So my patients who react to meat, their ratio is like 60, to dairy, their ratio is like 60, 70%. Yeah, so when you look at the alpha-gal number, you also have to look at their total as a ratio. The higher the ratio, that's probably a better predictor of how allergic you are than the number itself. I've seen people with levels greater than 100 who are actually eating meat and not reacting. And one of my most allergic alpha-gal patients, her alpha-gal IgE is like 0.7. But her total allergy antibody is like less than 1. Like she doesn't make any other allergy antibody except alpha-gal, and she's very, very reactive to dairy. So it's really, really important for the doctors locally to get both of those tests together if they're going to test you for this allergy. Next slide. Heparin is got some alpha-gal in it. Really, really rare that people have a problem with it, but it's important to know if you were going to go for like a bypass or something where you were going to be getting like a prolonged heparin infusion. They may want to pre-medicate. They would want to monitor you very closely during that procedure while you're under anesthesia for symptoms of anaphylaxis. But it's rare. Again, case report kind of rare. Monoclonal antibodies have been talked about, cetuximab. Armour thyroid is a kind of a natural thyroid substance. It's made from pig thyroid. So if you have alpha-gal, it's better to just go on Synthroid. Pancreatic enzymes for people with diabetes or cystic fibrosis or things like that. And then antivenom. So if you get bit by a poisonous snake, you guys probably don't have poisonous snakes on this finger. These are like my not updated slides. No wonder I got so confused before, because I spent all this time, it's not like an hour updating my slides today. I have diagnosed over 850 cases of alpha-gal. Next slide. We don't really have to go through this. This is our this young allergy fellow at NYU Langone in Nassau County. We're writing a paper on my patient population because there haven't been any published data on alpha-gal patients really in the Northeast, honestly. All of the case series are out of the South, so we're trying to contribute to the medical literature. So, I mean, people know, but it always needs to be part of the literature, so that's what we're working on. Skip, boring, I'm tired of talking to you about boring stuff. Go Skip. Those are just like how my patients, the breakdown of the different types of symptoms. 87 hives. Okay, so hives is definitely the most common presenting. And rash, rash and hives are probably the same thing. The stomach stuff, cramping, 34%, diarrhea, 20%, nausea and vomiting, 12%. And then this lightheadedness, and then it kind of goes down from there. Next slide. That's the conclusion for my study. You can see that. So this is a really, really important thing. In my opinion, an incredibly important thing. Sensitization, meaning having a positive alpha-gal test, does not always mean clinical allergy. Okay, so they've done studies in areas in the South where they just took all comers, like everyone who walked into allergy clinic, and tested them for alpha-gal, just to test them. Anywhere, depending on what study you look at, anywhere from 15 to 35% of the people living in an area where there are Lone Star ticks will have some measurable alpha-gal antibody. But if you look in those same studies, the actual percentage of patients who are having allergic reactions after eating meat is somewhere between 1 and 8%. So still not acceptable. I mean, we don't want anyone having allergic reactions. But it's important to know that just because you have a measurable alpha-gal test doesn't 100% mean you're allergic to meat. It means you could potentially be, or you could become if you kept getting bites. But I personally think that it should not be part of a standard tick panel. Like, not everybody should be getting this test just because you live in an area where there's Lone Star ticks. I think it's going to way overdiagnose it, and I think it's going to way freak people out. And I also think that just because you get a Lone Star tick bite doesn't necessarily mean you should run and get tested. Because guess when you're most likely to have a false positive? Right after you had a Lone Star tick bite. Sometimes people, I think, get a little transient positive, and it's gone within a week, and you never, like the patient number 2 in that study, they had a little bump in their IgE, but they never had a meat reaction. I think if you go looking, you're going to find it more than you want to, and it's not always going to matter clinically. Next slide. So that's it. So evidence suggests that tick bites can affect total and specific IgE to alpha-gal in some patients. We don't know why some patients get it and other people don't. We don't. I know one of you guys is going to ask me that. I'm just going to tell you we don't know why. It's not the specific tick that bites you. It's specific to the person, right? So if you already make alpha-gal antibody, any new Lone Star tick bite is going to bump up your numbers, okay? So the babies, it doesn't matter. Any Lone Star tick bite is going to bump it up. But not everybody makes alpha-gal antibody to the Lone Star tick bite. You're still trying to figure out why. And then the other points are that, like, as they go, as you get more bites, your numbers are going to go up. And the longer you can go without bites, your numbers are going to go down, okay? And this is my home. So it's beautiful here. It's beautiful where I live. That's the Montauk Lighthouse, which is about 25 minutes from my house. That's Main Beach. It gets voted the most beautiful beach on the East Coast. I'm sure some people here would probably disagree. And this is in my backyard. So we are clearly, not anymore, we got it fenced in. This is from my backyard a couple of years ago. And that's it.
Take some questions on either what I have to say or
I mean, I have my property. I don't, yeah, I do. I'm on the Stony Brook Southampton Tick-Borne Disease Advisory Board. We have kind of like, I think it's very similar to what you guys have. We have a tick advisory panel. We've got doctors and researchers, and one of the guys is actually owns a tick spraying company, but he's also like a major philanthropist. I know. It's not really been shown. The healthy kind is to me, is a waste of money. It washes away. I think that, to Patrick's point, I think you've got to approach it from a whole bunch of different angles. Like, protecting yourself is most important, but the more different steps you can take to protect yourself, the better off you're going to be. I mean, my yard, our season I think is very similar to yours. My yard gets sprayed from, I usually, what do we start, April or May? My husband and my son are back there. And we stop it, we go through October, and then we stop, yep, once a month. And then we say our dogs can't go in the backyard, what do they say, a couple hours? Yeah, I mean, I've got 2 little dogs. And so you know, like, I have plenty of other bugs in my backyard. Like, everyone worries that if you spray your yard, I don't really like bugs, and I can tell you there are plenty of bugs in my backyard. There are butterflies, there are ants, there are bees, there are yellow jackets, there are mosquitoes. Like, so I spray. We try to do as much as we can to not get tick bites. It seems like we have a very similar tick problem. I think we've just had the Lone Star tick a lot longer than you guys, and it's a very aggressive tick. Like I said, I grew up in East Hampton, so I went dog ticks mainly when I was a little kid. And then when I was like middle school age, people started getting Lyme disease, and then that was the big Lyme disease and babesiosis, and we still get that in the Hamptons for sure. It's still a major concern. But the Lone Star tick is now out-competing our other 2 tick species. So if you drag the ticks in East Hampton or any of the surrounding Hamptons, you're probably going to get 8 Lone Star ticks before you get a deer tick or a dog tick.
We get the question about if to spray yards when I do the residential yard surveys. It's one of the number 1 questions we get. And when I tell people, it's usually the last thing we'll recommend. It's kind of like a final resort option. It really depends on your yard and how many ticks we're finding, and how much your level of concern really. Sprays can work. They can reduce the number of ticks in your yard. It's not going to eradicate them, but it can kill upwards of 80%, depending on what you're spraying. Whether it's a pyrethroid-based spray is going to be your most effective. Our second next option is really, the one we recommend second is something cedar oil based. If you don't want to go the route of permethrin, and then anything below that we really don't recommend. There's companies that will spray like it's a mixture of essential oils. Cedar oil is an essential oil too, but the research shows that it does have some effectiveness against the ticks. Whereas the companies or sprays that you see with like rosemary oil, peppermint oil, clove, garlic, all these other essential oils, it's not providing the level of protection where we would recommend it.
I mean, your yard smells beautiful, though.
Yeah.
Yeah. Gentleman with glasses, yeah.
Thanks for your talk. It's very enlightening. Some things you said early on about the taxonomic distribution of alpha-gal carbohydrate. You said that it's not in humans and other great apes.
Right.
And it reminds me of a discovery some years ago that non-human primates and human primates who specialize in or are able to eat and digest unripe fruit, so it doesn't include humans, I don't think it includes great apes, have uricase. Uricase allows them to do the tannins in unripe fruits, and so they don't get gout. We do, because lacking uricase, uric acid crystals accumulating in the outlet rapidly. What this brings to my mind is whether there's any collaboration with evolutionary biologists who are working on biomedical issues to look into why it is that, did you also say monkeys? Don't
Any primate does
no
not
primates.
express it, right. So monkeys, apes, humans do not. They think it's due to an inactive gene product. So there was probably a mutation somewhere along the line where the gene doesn't make the active enzyme. It makes some inactive enzyme.
And what's the adaptive value of
Not having alpha-gal?
No, the adaptive value of having the non-primate species.
Oh, I have no idea.
So I'm just wondering if looking at the animal might come up
Yeah.
with something that could benefit us.
Yeah, well, they're working on, so there's a, kind of unrelated, but kind of related to what you're saying. For one of the biggest issues with alpha-gal prior to discovering this food allergy was that it's the major barrier to transplantation of non-primate organs into us, into humans, right? So we already have developed a genetically engineered gal-free pig that was initially developed for that purpose, to see if we could do pig heart organ transplants and things like that. They're now looking at those gal-free pigs and feeding them to patients with alpha-gal, and they do great with them. And actually, you can order samples of the meat if you have alpha-gal allergy and actually eat it safely. So some patients do that. Yeah.
I have patients who, as far as we can talk, have should have major surgery with their body. They end up using a lot of gel foam. And the person, because she moved here and she had an alpha-gal allergy before, we already tested her and she had a negative baseline and post-operatively, and she manifested meat allergy. Right after surgery, she had a high alpha-gal level, so we think it was the gel foam.
She probably got a bite. Yeah, well, I mean, we don't think anything else can cause it. Like, people don't get it from eating meat. They only get it from Lone Star tick bites. So I don't think that the gel, No, because I think if she did, I think she probably got a tick bite and got it between when you tested her before and when you tested her after. And I mean, if she had alpha-gal prior to, I would have thought she would have had also would have had a reaction to the foam. How long after the surgery did you check her alpha-gal, and why did you check it again?
Because she manifested.
Oh, she had a reaction to meat. How long after her surgery?
I can't remember.
Yeah, I would think she got a bite.
Relatively short interval, but because she had the major surgery, I think it was a long session.
She lives here on the island?
She hadn't been, she was out of it. She hadn't been out burning.
Mm-hmm. It would be a case report because, as far as we know, nothing causes it except a bite. I mean, it would definitely be a case report.
My other question is, and I get asked this all the time, is there a point to patients who are dying to eat meat and they come in and they want to be tested for titers,
Yeah.
see if they can now.
100%. Yeah. So you're a physician, I take it. Yeah. So I look for. So there's a study that I didn't put up here, but there's a study that shows that a ratio alpha-gal IgE to above 5.5 and an alpha-gal IgE to total IgE ratio above 2% has a 95% predictive value that if they were to eat, do meat challenge kind of dosing with a fatty meat, 95% chance they would react. But I often have patients who are very, very interested in reintroducing meat where we do a gradual home introduction, so very dose dependent, very fat dependent, and depends where your numbers are. So when their numbers and their ratio get very low, they don't necessarily have to be 0. I like to see them be comfortably below 5%, their ratio. I will talk to them if they're motivated and they're trustworthy patients, you know what I mean? I'll have them start adding some lean meat back into their diet, and they gradually work their way up, and then but we always have to follow and make sure they haven't gotten a new bite. Sometimes we get bites that we miss, and the larvae in particular are really tricky. If you step in a tick bomb, which I love that, I've never heard that before. Let's call it a nest, but a tick bomb is so much cooler. If you step in one of those, it's very obvious when you have 50 to 100 bites, but I get those bites off of my dog. I'll have 2 or 3, and I know that they're them because I know what time of year it is and I know what they feel like. But sometimes patients don't realize if they have 2 or 3 of those, they might just think it's a mosquito bite or something like that, or a little flea bite. So if they're eating meat and they're doing fine and they get new bites, it could be a whole different story. So I usually check start of tick season, end of tick season, unless they get a bite in between. And if they get a bite in between, and they're a patient who's gone back to eating some meat, okay? And then there's more subtle things that you have to talk about, are there long-term implications of alpha-gal positive patients who are meat tolerant eating meat for many years? And that's probably something I can talk to you on the side because it's hypothetical, and not hypothetical, but there's not a lot of data, but you wonder, could it be doing things long-term in these patients who are meat tolerant but do have alpha-gal IgE? Yes. No, you.
Is there a Lone Star? Is there a registry for this?
For alpha-gal, you mean through this? No, because it is not an infectious disease. So the CDC is not interested in collecting data on these patients because it's not an infection; it's an allergy. We've reached. They've been.
Lone Star ticks carry?
They do. They ehrlichiosis is the biggie. Yeah.
And how long does a tick have to be attached to?
It's called alpha-gal.
To stimulate an alpha-gal?
Not very long, because the larvae stay on hours at the most, and they can still cause somebody to make. So it's not like Lyme, where they say they want it on, the tick really needs to be on for 48 to 72 hours for the likelihood of transmitting it. They can be on much shorter than that with alpha-gal.
I don't know if there's some HIPAA thing, but I'm just curious if there's room, I'm not from the island, but is there any point of asking people, how many people here have been diagnosed?
If anyone wants to volunteer that, I guess. None of them are my patients, so no.
And then another thing I've been reading about is people who refrain from eating meat and possibly gelatin-related products and dairy. Have you seen any evidence that they can get rid of their alcohol?
No. So the only thing that makes as of now, the only thing that makes your alpha-gal number go down is not getting Lone Star tick bites. Eating meat, avoiding meat, the only thing that's going to do is either you're going to react or you're not going to react. There's no, if your purpose of avoiding meat is to make your numbers go down, it has nothing to do with it. Nor does acupuncture, by the way. Because the natural history of alpha-gal allergy is for the numbers to go down if you don't get a new bite. It goes down on everybody. So like until an acupuncturist does a study where they enroll 500 people or whatever the statistician says is the number you're supposed to enroll, and enrolls 500 on each arm, and half of them get acupuncture and half of them don't, and we follow their trends, and they showed that the ones who got acupuncture went down faster than the ones that didn't. I'm not convinced. I think it's just the natural history of the disease. I don't think acupuncture is going to hurt. Acupuncture serves many fantastic purposes, and I am a huge, tremendous fan. One of my neighbors is an amazing acupuncturist and a dear friend, but I don't think that it's going to make your alpha-gal numbers go down any quicker. I think all you do when you have alpha-gal is you don't get new Lone Star tick bites, and the numbers will go down. Yeah.
Just to the point, how many people? I know 35 people on the island, at least, that have told me they got alpha-gal, and I think I just added about 5 more watching. We do need to have an industry, and Board of Health is considering starting an alpha-gal self-help group, get-together group to share and stuff like that. I think that's really important. If you know somebody who works at your Board of Health, tell them it's something you want to see. They've been talking about it almost a year. Something you should just be the one to start it.
Well, in my opinion, it's a public health issue. The fact that you have this, even just the nutrition recipe registry or resource is pretty cool. I mean, people forget that on an island, we get virtually 100% follow-up in terms of studies. East Hampton's closed because you're on Long Island, but a place like this, I mean...
It's a great place. I mean, the problem where I live and work is that it's become, because it's caused by a tick, it's a food allergy, right? It's a food allergy with a lot of nuance. I always say, like, if you had a patient with a peanut allergy, you wouldn't be managing it yourself, you'd be sending them to an allergist. But a lot of providers where I live who don't really understand the science or exactly how to manage it, because they're called upon to take care of so many tick-borne diseases, they kind of just lump this in. And I think they're testing some people inappropriately. So that's a real concern of mine, is how many people are reacting to meat and how many people just had a positive test because it was sent, right? So there's a difference there. And I spend half my day, well, no, I see other patients too. I see people with asthma and other food allergies, but I see a lot of patients with alpha-gal, a lot. Like, even in the middle of winter, I probably see 1 or 2 a day. But about at least half of them now, and this is different than when I first started taking care of this allergy, at least half of them are people who have a positive test who I'm not entirely convinced have alpha-gal syndrome. So they're having chronic hives. And their primary care doctors, very well intended, test them for this. Even if they're getting hives and they're not eating meat, on a day that they eat turkey for dinner and they're breaking out with hives, then obviously their hives are from something else, because there's no alpha-gal in turkey, right? But they have a positive test because, like I told you, somewhere between 15 and 35% of people, if you live where Lone Star ticks are, will have a positive test. And that's when they go down the Facebook group rabbit hole, where I'm having hives every day. I took meat out of my diet. I'm still having hives. I better take dairy out of my diet. I'm still having hives. I better take gelatin out of my diet. I better take carrageenan out of my diet. I've had a guy who's nearly ready to be hospitalized in a mental institution. He's lost 30 pounds. He's afraid to eat food. And first of all, his alpha-gal level is like almost invisible. But he's been misled from being in these chat groups that the reason he's not getting better is because he's not avoiding enough stuff. He thinks his coffee was filtered through bone char, like things that, I take care of this allergy for a living. I've never heard of that. And what it is the man has chronic urticaria, which is another thing that we as allergists take care of. I see 10 cases a month. And he needs to be treated for that and not just keep taking more and more and more out of his diet. So a positive alpha-gal test is only helpful if it fits with the clinical history, meaning if the story sounds like one of those first couple of patients that I described. Yes, in the pink.
Thanks. I was glad to hear you did grand rounds here at the
Yes.
hospital. That's great. There was a big kind of debate last summer about these horrible blisters towards the end of summer.
Yeah.
I didn't really hear shivers, but I heard both nights.
Yeah.
And then I heard these larvae, and having been a victim myself of these really nasty bites, the provider's office I went to knew absolutely nothing about it. They were like, ooh, how do you know this?
Yeah.
And so I don't know how much that matters in the big picture.
It matters a lot, and I hate to say, I mean, we've had them here a lot. We've had them in our place a lot longer than you guys have had them. We still have providers who are telling people they have chiggers and they have mites under their skin. And right, and it's not. It's right. And
So it matters because
it matters because it can cause this allergy.
it can cause the allergy.
And if you're someone who has the allergy, for example, and it's getting better, meaning you've gone a while, you haven't had any bites, and you've been able to add back meat, you need to know that those are actually Lone Star ticks. And if you get those, they're not mites, they are Lone Star tick that are going to make the allergy worse.
What other thing, I noticed in one of the slides about dairy that is a cow's milk specifically.
It would really be any milk. Yeah, it would be cow's milk. That's like an allergist thing. Like, if you're not, no, that's a really fair question. So goat milk, sheep milk. In theory, it should be the same thing because it's all mammalian, but it's really rare. Yes, at the mask.
I'm Dr. Jerry Fitch. I just wanted to take a couple of minutes of time to have you here.
Thank you.
After we talk on the telephone, and thank the ag society, wonderful. This is public health work as wonderful. So I want to say on June 10th at Catholic Cornell Theater, we're going to have another conference on tick-borne illnesses, acute diagnosis and treatment. We have Dr. Sandy Alford come down and talk to me as Dr. Rob Smith from the University of Maine, and Patrick's going to be there. And we're going to have some panel discussion. It's going to be from 8:30 to 12:30 on Saturday morning, June 10th. So put that in your calendar. If you have other questions, these guys are also qualified to talk about. So it's free.
Yeah, we do something like that at home too with our tick-borne disease resource center. It's awesome. So great. That's so great. Yeah.
I, a year and a half ago, had allergic reactions, a week later, took a test and got diagnosed. My levels were at 8. And working with an allergist, frequently, we take a test again. A month and a half, 2 months later, my levels went up to 16. And I had visually.
So they were probably still on the way up.
Yep.
So they go up. Everybody is a little bit different. But they go up. If you get alpha-gal syndrome, your numbers go up over like 2-3 months, and then they start to go down. So you probably didn't. You may have gotten new bites, but you may have just still been on the rise. Like the first test may have been too soon. If you don't get any more bites, they'll start to go down.
And after 4 months, I started experimenting. And maybe whatever.
Yeah. So a lot of people experiment, and it's. A lot of people define experimenting, but remember, number one, it's very unpredictable, and those cofactors can play a role, and the fattiness of the meat and how much you eat. It's good to be like somewhat like educated in experimenting. So like you should kind of know where your numbers are when you're experimenting, and maybe like experiment a little less during tick season and experiment a little more in the middle of the winter. And experiment with lean stuff. Don't experiment with, a hamburger from your favorite, restaurant. That should never be the first thing you try. Then you're going to dabble.
For the larvae, is there studies that have proven that the larvae actually transmit?
I mean, there doesn't really have to be studies. It's very, very evident. I see it all the time, a patient who didn't have it.
You're their first host, right?
Yeah, so it's not an infection. It's something inherent to the tick, right? It's not a disease. That's why we can't put you on an antibiotic and prevent it, right? There's something inherent to Lone Star tick saliva, possibly actual alpha-gal in their saliva, but they're not getting it from a previous host. It's just in the tick. it's either alpha-gal or it's something that looks a lot like alpha-gal that gets injected into the host. So the larvae are probably the most potent cause of this. I see the most cases of alpha-gal syndrome in new cases in October and November, and it's always like, I got larval bites, and 3 weeks later I went to a restaurant and this happened. Like, it definitely causes it. They're the worst for this. They're worse than any adult or nymph tick, because it's like getting 50 Lone Star ticks at once, or 100 or 200, however many are in your tick bomb.
Yeah, you might have like one or two bites from an adult, and you can feel it really quickly.
Right, exactly. The larvae for me are the biggest problem. Yes, in the blue and white shirt.
Yeah, you specifically mentioned in your case studies, several of your case studies, they took Benadryl. Did you mention that's just good or bad? Or just
So again, I updated all these slides, and then I pulled up like some old talk. I have a little slide about that. Everyone gets an EpiPen, but almost everyone can be treated without Epi. And I say almost everyone. I definitely had patients have anaphylaxis and need to use Epi. Most people can take a good dose of a Benadryl or even a non-sedating antihistamine, even like a Zyrtec or an Allegra, and ride it out. But they all have EpiPens. What was I going to say? I don't remember. It'll come back to me.
they all have it?
I give everyone an EpiPen, even if they've never had anaphylaxis before, because the allergy changes, right? So it's just good. And I just always tell them, like, look, you're probably not going to need to use this, but I'd rather you have it and not need it than the other way around. And I counsel them on how to use it and what symptoms I would recommend they use it. And I have had some patients who have needed it. Yeah.
Sorry, I arrived a little late. Did they not miss that we talked about the season? What is our season? What are we trying to do for window? Is it now to October?
Yeah, essentially. So the first tick, the earliest I found a Lone Star tick questing, which you'll find in the invite you, was the third week in March 22nd. That's the earliest I found an adult tick. Really don't start seeing numbers increase till about this time in this time in April, and then in May, mid-May, the nymphs really start to dramatically increase. So I said on the slide, March through October, you'll see Lone Star ticks, but mainly May through July. And then the larvae, I always kind of brush them aside, because in the tick world, as far as infectious disease, the larvae were not the most transmitting disease. And I was a little concerned to hear that today, because now you have to worry about the Lone Star tick a little more than you regularly would. But the larvae, they come out in the fall months, so they're the last, the last of the progression through the year. So they come out August and will last through October. And we can find nymphs into September.
Yeah.
I'm just wondering, is there any hierarchy with regard to species like would cow's milk be worse than sheep milk or?
Well, it's more the fat.
It's the fat milk.
And to be honest, it really truly is very uncommon for patients to react to milk, in my experience.
I have alpha-gal, I've got it since 2020. And the fake cheese is like the worst.
Have you tried dairy? Have you tried? Yeah.
And I've done, I tried to have a little bit of, I had yogurt first, and I was tolerating that. Yeah. And then I got a little bit of cheese, and they seemed to have some pizza, and I didn't die. But then I ate cheese like 3 nights in a row. I had cheese and crackers. And the third night, I was at the ER, I was broken out. I mean, there's anything to, I've heard that with food allergies that if you eat like 2 days, you're okay, and then
it shouldn't work that way. It shouldn't work that way. It's more this unpredictability of alpha-gal that if you had cheese and you took a Advil, or if you had cheese and you were sick, or you were under stress, or you had gotten sick like a month before and your numbers were going up each day. So it's not so much the eating it, but I'd be very curious to know what your numbers are, because that's not cheese. It's really, I'm not just saying this because I want you all to go home and eat dairy and have allergic reactions. It's really not common. Like I said, I have over 850 patients. I can't remember them all, but I can remember most of them who react to dairy. That's how rare it is. That's how not common it is.
I've heard that before, but Dr. said that it was lactose intolerance, and it wasn't whatsoever related to.
Well, I would say lactose intolerance is far more common than people with alpha-gal syndrome reacting to dairy. Like Scott Cummins at UNC, who is I know a lot about alpha-gal. Like, he's like the guy who does all the alpha-gal research. He doesn't tell his patients to avoid dairy routinely, nor do I, and it's published in the alpha-gal guidelines. Like, we do not routinely recommend that patients avoid dairy. And it's not to say that I'm not saying people can't have reactions. I'm not saying I've never seen it, I have. But I've been taking care of this allergy for 12 years, and the fact that I can think of all my patients who are reacting to dairy makes me think that a lot of times it's lactose intolerance or something different. And I don't know, I don't have your labs in front of me, I don't have your whole medical history, I'm just saying that would be very atypical for such a great percentage. The published data says less than 10%, and in my experience, it's much less than that. Yeah.
So it's possible that there's a geographic or demographic area. So
yeah, sure.
I have a feeling.
It'd be interesting to do challenges, to do like challenges and check serum tryptases, like after the reaction, and see if it's actually an IgE-mediated thing that's happening. Sure.
Too often they're recruiting the Thursday.
We buy it?
Tick bomb?
A year ago in the fall. And then this last July, I think it was, I came out, I got bitten by a lung tryptis. And then I got gout. I just got bitten by another one today. So should I go get tested to find out what my...
Yes, but I probably wouldn't do it tomorrow. You're already not eating meat, right? Yeah, so I would probably wait at least a month. Because I think if you check it too soon, it's probably going to be lower than where it's going.
I'm going to get more, I'm sure.
Yeah, if you're not eating meat, it's not as big. If you're already avoiding, it's not as big of a deal. It's more for patients who their numbers have gone low enough that they've been able to add it back, where I tell them, look, if you get a new bite, you have to stop what you're doing, and we have to check your numbers in like 4 to 6 weeks. But if you're already avoiding, it's unlikely to do anything much more. Yeah, so it's not torture for you. Other patients act like I'm giving them a death sentence when I tell them I haven't. I get it. I'd be sad.
This is a question for either of you. Do you have any recommendations as far as outside of the normal, obviously my practice gets the tick medication, but hearing that they are actually preying on you and not just like a casual run-by, which is what I was going off of or what I was imagining, like having the dog even sleeping next to my bed rather than on the bed feels like...
It's a better choice. I mean, it's a better choice.
That's a tough one to say, because we'll recommend no dogs in the bed, and get a lot of pushback.
Yeah.
But I tell people pet transfers are probably the third most common way of getting ticks.
I think that's the only way I ever get ticks.
If you're not getting them in your backyard, you're not getting out when you're out hiking or going for a walk, they're coming from the dog.
And your dog is treated, so let's say your dog steps in the larva, but your dog is on tick medicine. It doesn't mean the larva don't get on your dog. They just get on your dog and don't want to bite your dog, and then if you're sitting next to your dog on your couch, the larva probably crawl off the dog and onto me. I get a couple of larval bites every August and September, and I'm super, super careful. I know it comes off my dogs.
Well, I'm a veterinarian, I'm retired, but so far as I know, most of the tick preventative medicines you use on your pets don't work on the Lone Star tick. So it's very species dependent as to whether certain anti-flea tick stuff is going to work specifically on that species of tick. So you have to check the packaging to find out if it is useful against Lone Star tick. They don't all work against the Lone Star tick, so it really depends on.
That's good to know. And it'll say it on the packaging.
That's kind of massive news, I guess.
Yeah. I'm really the same way. I'm like, I don't check my tick medicine.
I don't because I'm retired. So I'm not really sure.
I see this gentleman way by the window.
Question for the veterinarian as well as you. My daughter has a dog, and I just got finished telling you the other day, maybe it might be helpful to take a bandana and use the epinephrine.
Oh.
Could you put that
And we don't recommend using tick repellents that are meant for human beings on our pets. They're not designed for that. So.
Why haven't they invented a pill for humans?
I'm trying. I wish I could. I would be retired too.
The theory I've heard among veterinarians is that our pets don't live as long as we do. So taking these things every month for their entire life, the cumulative effect wouldn't be the same as an animal like us that's going to live hopefully to be 80 or older, taking something like that every month. Because we do know that with that some of these pesticides have cumulative carcinogenic effects. So now I can't think be specific about which ones, but I guess the theory is that's something that I just heard people talking about. Is the problem is that, Fluffy is only going to make you live to be 14. And for 14 years, it's not going to hurt Fluffy. But if Fluffy lived to be 84, it might be a problem.
Makes sense.
So I don't know if that's true or what that is. So
again.
Amongst other things, you made an incredibly good case for a strong central public education campaign.
Oh, for sure.
And the maps that show the distribution of Lone Star tick and the distribution of cases provides you with a head start on who's lobbying Congress to get federal funding.
Yeah, it's really hard to get funding.
Not only people with the syndrome, but from what you're saying, the providers as well.
Yeah, I mean, my friend Scott, who does like the bulk of alpha-gal research, he's at UNC. He was at UVA with Tom Platts Mills. Now he's at UNC, and they're two big alpha-gal researchers. And he spends a greater part of his life writing grants trying to get money to study alpha-gal. And the problem is, like I said, when you look at that Lone Star tick map and half the country looks yellow, it's alarming. But it's really not like that. It's like us, the Hamptons, and you guys, and rural Virginia. It's a horrific epidemic for us. But my sister lives 80 miles west of me, closer to the city, in a kind of suburban area. Her kids literally roll in the front yard, and they were yellow on the map, but they don't have ticks in Manhasset because they don't have deer in Manhasset. But so it's the problem is it's kind of like Lyme disease in that where it's a problem, it's a really, really big problem. But when you think of all in terms of public health nationwide, it's hard to say it because it's like my life. I see so much of this, it's my life. But it's such a small public health concern compared to so many of the others. Even if you compare it to Lyme disease, like alpha-gal syndrome, it's really life-changing for people. But it's a food allergy, so don't eat the food. The government's not freaking out that people can't eat meat. They're like, okay, then don't eat meat. You know what I mean? It's to us as scientists and clinicians, it's fascinating, and we see how it's impacting people's life, but it's not like it's causing, neurodegenerative conditions and arthritis and or cancer or things like that. At least we don't think so. So I think I 100% agree that we need much more funding to study and research this allergy. The problem is there's not a lot of people doing it, and because it's such a big problem in such a relatively small part of the country, even contrary to what it looked like on the map. Yeah.
Isn't there an increasingly developing literature, scientific literature, that there are other symptoms and effects from alpha-gal?
So there are some possible theories. Yeah, that's what I was alluding to you. Yeah, so there's there's some thoughts that people who have substance. So there was a small study where people with alpha-gal and alpha-gal antibodies, mostly non-clinically reactive to meat. So they basically they did it the opposite way. They studied people who were having catheterizations, who had coronary artery disease in the region where Lone Star ticks are prevalent, and they did some echo, some cardiac vessel echo or something, and they measured alpha-gal levels in these patients, and these were presumably patients who did not know they had alpha-gal antibody. And they did see that in this small study, that the group of patients who had alpha-gal antibody tended to have a greater plaque burden and more unstable plaques. I mean, I think it's far from proof that that's a problem, but it is definitely something that needs to be studied further. And that's kind of what I was talking about. So I have lots of patients that their numbers get low and they want to add meat back before they go completely to negative. I don't think there's sufficient data to say that they can't. But there are questions about could there be other long-term implications about eating meat when you have subclinical alpha-gal syndrome, meaning you make antibody but you're eating meat without anaphylaxis or without hives or without GI upset. Yes, and that's one of in my doctor talk I have a slide where I talk a little bit about some of the other things that they worry about, people who get bioprosthetic valves that are part pig valve. Well, those valves degrade quicker or fail quicker than someone who doesn't, have alpha-gal syndrome. But but they're better valves than the mechanical ones. So, people who get mechanical valves have to go on blood thinners for the rest of their life. So everything is sort of, weighing. You have to weigh both sides. But yeah, so there are questions. None of it is like definitive, but there are things that they're studying and they're trying to do bigger studies.
Do you have any remedies for the non-steroid itch?
Steroids, I mean, it depends if somebody's really that bad. I mean, they sell this stuff in the pharmacy near us that's called Chigaway, and it just has, which is ironic because I spend my life telling people that they're not chiggers, but it's like a calamine with like a lidocaine in it that's kind of soothing. But if people are really bad, I usually just, and especially if they don't have a lot of comorbidities, if they're like a young healthy person and they're just miserable, I'll just put them on a short course of oral steroids, and it kind of gets them over the hump of when they're their most miserable. Yeah, there was like a really small study that said topical permethrin helps, but I don't understand why it would, because it's not, the bugs aren't in you at that point. Permethrin is like an they fall off now.
I think most people, when they prescribe permethrin, they put it on you to kill the larvae so that so little as possible to pick them off.
That would be, that would be helpful.
I was aghast.
I saw one of my friends who's a dermatologist emailed me this small study she found that did show that people with the larval bites who got treated with permethrin got better quicker. I just don't know why it would. It's really an allergic skin reaction to the bites. I mean, the ticks usually fall off on their own in a couple of hours. Yeah, they do. But I don't think you're still getting bit. That is, you do see that. They do crop up, additional bites crop up over days. But I don't think they're new bites. I think it's a different pace to your immunologic response. I'm kind of making that up, but I don't. Yeah, I think they come out kind of slowly and gradually that way.
Question for Patrick. Early on, you mentioned the weather having a bearing on numbers of cases and stages. And isn't understood what the actual constraints are that are imposed depending by the weather on the ticks, or is it the ticks are based what the ticks are doing is based on temperatures and their hosts?
What based on temperature constraints? So a lot of people think that the cold winters are killing ticks, and that's not true. They can survive the winters, and ticks can actually, I learned a little bit ago, they can produce antifreeze, so they can survive cold temperatures. That said, we really wouldn't find ticks active and questing below 35 degrees. And even around 40 degrees, that's usually the cutoff. It's above 40 degrees in the winter, that's when you'll find ticks. For the summertime, it's really dependent on the humidity. So this past summer, it was really hot and dry. During our surveys, we're still finding lots of ticks, plenty of ticks, but we're finding proportionally less than Dick has found in recent years because it was just a long, hot, dry summer, and when they go out to quest, it dries them out. It's the desiccation that kills them. So we recommend people, when you get home from being outside, you can throw your clothes in the dryer for 15 minutes, and that'll kill the ticks. It's not so much the showering that will get rid of the ticks, but throw your clothes in the dryer, it's not Yeah, it's the lack of humidity, the lack of moisture.
Just since it's 7:15, I feel like it's best for us to close this down, but Dr. McGinty will still be here if people have additional questions. While Dr. McGinty is here, we're doing various things to try to build community among people with alpha-gal. So if you have alpha-gal, please email programs@mvagsoc.org and we can share some of the other things we have going on. Thank you all so much for coming. We really, really appreciate it.
I do telehealth as well. I would have to, I don't know how many there are in your area who are really familiar with it. But I do telehealth. You'd have to probably call my office. I've seen people from Jersey for sure. No, they don't. It's not against them. They don't. Because you can know what it is, but if you don't see it and know the literature really well, you don't really know how to treat it properly. You know? Yeah, for sure. I can even give you one of my cards with